Regional Behavioral Health Policy Board for June 7th. And Valerie, if you could take a roll just to make sure we have it recorded as to who's present.
Chair Fergus Lockridge.
Present.
Brooke O'Byrne is excused. Senator Pete Goycochea. Dr. Erica Rist.
Present.
Matt Walker.
Here.
Amy Adams will not be attending. Amanda Osborne.
I'm here.
Chris McCann.
Present.
Patrick Rogers is excused. Sarah Dearborn is excused. Bryce Shields is excused. And last but not least, we have Jerry Sanders.
Present.
Awesome. Yes, sir, we do have a quorum.
Perfect. Let's go right into item 2 very quickly here. Public comment. Do you have anybody from the public that would like to keep your comments to 3 minutes or less?
And just for housekeeping purposes, public testimony under this agenda item must be presented by computer, phone, or written comment. If a member of the public would like to participate via phone, dial 408-638-0968 or 669-900-6833. And when prompted, enter passcode 139559. Due to time considerations, each individual offering public comment will be limited to no more than 3 minutes. If you are joining us via Zoom, if you could go ahead and hit the raise hand reaction, that would make it easy to tell who needs to do public comment or not. And Fergus, if nobody raises their hand, I have something to pop in with. Oh, Taylor Morgan.
Hello, good afternoon, everybody. Gosh, where has this day gone? So Taylor Morgan, I'm with Nevada Office of Suicide Prevention. I hope this is the right time to mention this. I just wanted to give a quick mention. There's an assist training that we are setting up for ELCO in August. We had one scheduled for next week but had to cancel it due to lack of registration. And so I thought, okay, if we can get the word out early, I wanted to spread the word on that. Dates off the top of my head, I think it's August 5th and August 6th. It's going to be Lynette Vega and Wendy Charleboy, who are instructing that. Could I throw a link in the chat box for everybody? Is that okay? Is that appropriate?
Sure.
Very appropriate.
Okay, will do. Thank you very much. I will throw it in shortly. Thank you.
Great, thank you. Any other public comment? Valerie, you had something?
Yes. So for the record, Valerie Haskin, Rural Regional Behavioral Health Coordinator. I just wanted to put the call out there that unfortunately, Amy Adams has decided to step away from the board. And so we are looking for someone who is specifically able to represent drug and alcohol counselors. It is a position that is defined by that licensure type. Or that licensure category. So if you are interested in that position, please let me know.
Okay. Any other public comment? Not hearing or seeing? None?
Fergus, wait, hold on, Fergus. Laura Osland had her hand up.
Oh,
I did
okay.
have my hand up, and along with the assist training, if they are in my coverage area in the Tri-County, Elko, Eureka, or White Pine County, I have said that PACE should be able to at least pay mileage and 1 hotel night if they are coming to do the training, but they have to be in one of my counties, otherwise my grant won't pay for it.
Awesome.
So if you recommend it to somebody, let them know if they don't have. I can pay for hotel and mileage, but I can't do the per diem. I can't do the food per diem on this grant.
Very helpful. Thank you, Laura. Okay. The link Taylor has provided in the chat. And spread the word. Let's get folks there so they don't have to cancel this one too. Okay. Valerie, any others?
I'm not seeing any.
Okay, let's move on to item 3, the review and possible approval of our meeting minutes from the May 3rd. These were sent out to the board. And you should have had a chance to look at those. We'll entertain a motion to accept or any edits.
This is Matt. I'll make a motion to approve.
So moved by Matt. Is there a second?
This is Amanda Osborne. I'll second.
And Amanda to second. Okay. All those in favor signify aye.
Aye.
Any opposed? Hearing none. Thank you. Passed. Item 4. This is a possible definite action is to review the annual report for Valerie. And she's submitting that to the Governor's Commission on Behavioral Health. Valerie, you want to lead off on this one?
Yes. So for the sake of brevity, I know we're trying to keep these meetings to only about an hour long. And so going through that whole, I think 50-page document would take that long, as it is. So I'm going to throw it out to board members. Would you like me to bring up the document and review any specific pieces, or are you comfortable as it is? Do you have any questions? What are your thoughts?
Speaking on behalf of myself, I read through the report that was disseminated. See anything real glaring, but Valerie, are there any true high points that you think that need to be brought forward at this time for the public that didn't have a chance to see that? Just the high points.
So we did have, I'll go over some of the data pieces. So from the data highlights, the data highlights were not included in the 2022 annual report because I received the biannual SAPTA regional EPI report the same day that the draft annual report was due to the Commission on Behavioral Health. So unfortunately, I was not able to include that with 30 minutes. However, so I wanted to run through some of this information, some of which is from the 2023 Rural and Frontier Health Data Book. And some of it is from the SAPTA EPI report. So those are noted in the references. Getting down past the population changes or the demographics, which no major population changes in any of the counties that would really affect behavioral health per se when we're looking at statistical levels. Mental health and suicide. In 2019, and a lot of this stuff is 2019, which is tough because obviously that's pre-COVID and that was kind of a different world. So we did still have, even pre-COVID, obviously a lot of issues with suicide and mental illness amongst all age groups. But then when we get down here into 2021, this is actually from the YRBS and reported in the the SAPTA EPI report. And the YRBS is the Youth Risk Behavioral Health Survey or Behavior Survey. And so some things that I wanted to point out from 2021. In 2021, 45.8% of high school students residing in the rural region reported feeling sad or hopeless, compared to 46.1% of high school students statewide. So that's not too bad. At least we're not quite as bad off as the rest of the state, I guess. For the same time period, 34.9% of middle school students residing in the rural region reported the same thing, compared to 34.6%. So we're about on trend with the rest of the state. However, nearly half of the population is a lot. In 2021, 21.7% of high school students and 20.7% of middle school students residing in the rural region reported considering suicide, which is still a little bit or approximately the same or similar to that statewide, but still very alarming. Same time period, 21.7% of high school students and 13.9% of middle school students residing in the rural region reported having planned to die by suicide. Again, that's approximately similar to that statewide. Same time period, 12.1% of high school students and 8.1% of middle school students residing in the rural region are reporting having previously attempted suicide, which is again somewhat similar to statewide numbers. There were significant decreases in emergency department encounters among residents of the rural region from 2018 to 2021 for the following diagnoses: anxiety, depression, suicidal ideation, bipolar disorder, PTSD, and schizophrenia. However, it should be noted that there were fluctuations throughout that downward trend. So obviously throughout COVID and that time period, things changed quite a bit. Inpatient admissions for anxiety and depression remain higher than inpatient admissions related to mental illness, other mental illnesses, although they fluctuate greatly across the year. The number of unique adult clients served by state-funded mental health facilities. So that includes rural clinics, as well as, I believe, NAMS and SNAMS and probably Lakes Crossing, hit a low of 746 clients in 2021. However, when we're talking about the context of these particular agencies, that's not necessarily a good thing, because these are individual and unique clients. So that may be that people are staying in longer. Also, these particular agencies did experience decreased capacity over previous years in the wake of COVID because of hiring issues. So it sounds great, but likely not awesome. Utilization rate for state-funded mental health services located within each county of the rural region. So Elko County, that's 34.42 per 10,000 population. Eureka County, 21.22. Humboldt County, 87.59. Lander County, 76.77. Pershing County, 84.13. And White Pine County, 179.56 per 10,000 county population. Top two mental health clinic services by unique, or the top mental health services by unique number of patients served by these state-funded clinics. And these are really the outpatient clinics for the most part. Ely outpatient clinics received for counseling, that was 91 patients. Ely medication clinic was 155 patients. Elko outpatient counseling was 82 patients. Elko medication clinic was 157 patients. Winnemucca outpatient counseling, it was 60 patients. Winnemucca medication clinic, 134 patients. And so looking at adults in 2021, of respondents to the BRFSS, which is again adults, 10.6% of respondents located within the rural region reported having considered suicide. Also in 2021, emergency departments saw 44 suicide attempts utilizing substances in the rural region, which was the highest of all methods analyzed. There were also 18 attempts reported utilizing cutting as the method, which is much lower number for firearms, drowning, blunt objects, and other methods. So looking at mental health concerns and particularly mental health crises and suicide, unfortunately, our region is in line with the rest of the state, and we're still seeing a lot of pervasive issues. Again, this is 2021, so this is approximately 3 years ago. We don't have numbers that are published that are any earlier than this, or later than this, rather. So I wish we had more recent numbers. Percent of adults reporting excessive alcohol use by county in 2022. And then there's the percent change in parentheses. Really, they're all pretty similar, hovering about, let's see, we've got about 19.3 for Lander County, and the high point here is Eureka County at 22.1%. So it's about the same across the region. There's some really broad variances in the percent change, which likely has to do with data collection more than actual changes in trends. As per the demographic below, in 2023, the rural region saw increases in the number of suspected overdoses in the spring and fall. And that is from the syndromic surveillance and prescription opioid rates for the rural region. Okay. Self-reported substance use by high school students, combined counties. So we've got Elko, Eureka, and White Pine together, and then Humboldt, Lander, Pershing, and Churchill counties together. The reason why the state does this is to make sure that the data is de-identified because it's very small numbers usually that are able to report, and B, to increase the number so that they can actually look for statistical significance. So for Elko, Eureka, and White Pine, marijuana among high school students is at 30.9%, vaping products 26.9%, binge drinking 21.2%, prescription drug abuse 13.5%, and current smoking is 7.7%. And I remember the days when smoking was the big bad. Many moons ago. All right, Humboldt, Lander, Pershing, and Churchill, marijuana 34.5%, vaping products 24.5%, binge drinking 18.8%, prescription drug abuse 20.9%, and current tobacco smoking 11.8%. Unfortunately, having Churchill County in there kind of does throw these numbers off a little bit. It also crosses some boundaries for the different coalitions. So Elko, Eureka, and White Pine is covered by PACE Coalition. However, Frontier Community Coalition does not cover Churchill County, but they do cover Mineral County. So that was kind of an interesting grouping for that statistical purpose. Really no surprises with behavioral health workforce. It didn't really no apparent changes there. Insurance coverage, also no changes. We have really great general insurance coverage across our region, largely due to mining. So percent of county population having some kind of insurance coverage by county. So that includes Medicaid, Medicare, as well as private insurance payers. Elko's 90.6, Eureka's 89.9, Humboldt's 88.2, Lander's 92.1, Pershing's 89.2, and White Pine's 93.1. Looking specifically at Medicaid, we're looking at between, I think Pershing County has the low of 18.7% of the total county population, and it looks like Humboldt County has the high of 25.3% of the total county population covered by Medicaid. Anecdotal information from stakeholders. So this is all stuff that I have already voiced to you, so I'm not really going to beat this into the ground any further. And also all the data issues with not having access to timely data that is truly relevant to the here and now, as well as not a lot of access to consistent and comparable mental health crisis data. So that is a consistent issue. I included your 2023 behavioral health priorities and also spoke to the progress of AB 37. The report is also required to list out the different meeting dates and topics. You guys had a lot more meetings last year than you did in previous years with a really broad variety of topics. So I really would like to, first of all, commend you guys for all of your time and work and effort on that and for sitting through all of those meetings, because I know that that's a lot. And then I just yammered on about the things that I've been doing. Stakeholder activities is a new section for this year. Talking to Fergus, he really wanted to be sure that we included these pieces. Brooke O'Byrne did request that I add in some information here about Humboldt County School District's Project Aware work. And so she was going to send me a blurb about that to add in. So that would be the only edit. I have not received that yet from her. So when I do, that would be the one thing from this version that would potentially change. So I included the work of Elko County Zero Suicides, Humboldt Connections, PACE Coalition, Frontier Community Coalition. Mentioned in brief some of the projects of the school districts that I was aware of. NAMI Western Nevada, there are different worm lines, text lines, carrying contacts, and work with VCC. NAMI Northeastern Nevada, which has recently launched. State level work and county level opioid assessments for the Fund for Resilient Nevada. DPBH and their efforts to expand the in-person response for the Children's Mobile Crisis Response Team, which has, from what I understand, was picking up steam before school closed. Summer is always a slow time for them. So those numbers may drop over summer, but it is anticipated that they may pick up again come fall. And then in our region, most counties, at least at the county level, are participating in the Virtual Crisis Care or VCC program for rural law enforcement. Winnemucca PD and Elko PD are also participating at the city levels. And so that's really the meat and potatoes. And then I included different data sets here at the back and your 2023 priorities. These are all the monthly reports from the OD2A program. They're published online. You can easily access them publicly if you look up Nevada OD2A. And what else do we have in here? This is another piece that was new. So the Recovery Ecosystem Index mapping from NORC at the University of Chicago. And these are the Nevada maps. And so this was something that I learned about at the RX and Illicit Drug Summit in Atlanta, was this particular tool. And essentially the darker orange the county is, the fewer resources there are relating to recovery. And so here in figure 1, we have just overall recovery system index, overall score. Looks like Pershing County is doing pretty decently. Then looking here at figure 2, this is specifically regarding substance use disorder treatment. Our region's struggling a bit. Recovery Ecosystem Index, continuum of support. So those are peer support programs and the like. We're actually doing much better in that arena overall. Recovery System Index, infrastructure and social factors. So this is looking at the social determinants of health, including average wage, statistical numbers regarding insurance, and a lot of those demographics that we covered earlier. So our region is generally doing better than most other places when contrasted with the challenges. Drug overdose mortality rates. This is 2018 through 2021 in Nevada by county. Lower than some of our counterparts, so I guess that's good. Overdose mortality rates, again, for Nevada by county, and this is specifically for opioids, whereas the one on the left is for drugs in general. So as you can see, they're the same for our counties. And then this last one is the substance use disorder treatment score with drug overdose mortality rate overlaid. So when we look at these large pink dots, those are the drug overdose deaths. The bigger the dot, the more deaths there were in that county. And then the treatment score, so the dark orange being the worst as far as having treatment resources and green being the best. So while we have across our region generally very weak resources for substance use disorder treatment, with the exception of it looks like being Humboldt County, we did have very few overdose deaths. So I'm going to kind of skip over the rest of this. This is available or will be available upon approval. And these are the 2023 priorities from last year. I did not change any of these. I just simply moved them into this report as well because we have not yet had a chance to review them. So that is kind of an overall. I would like to entertain any questions or comments from the board.
Hey, Valerie, it's Erica Rist. Along with the request from Brooke to put in Project Aware, can we also put in right next to it the TIS grant, which is Trauma Informed Supports in Schools? Pershing is participating in that.
Yeah, that would be wonderful.
Great, thanks.
Can I reach out to you and get some information on that?
Yeah, sure.
Okay. All right. And then where?
Any other questions or insertions by the board? Valerie, this is listed as an action item. Are you requesting that the board approve as as is with the additional amendments by additions by Brooke O'Byrne for the Project Aware and by Dr. Riss for the Trauma Informed Support Schools.
Absolutely.
Okay. Board, you've seen the report, you've gotten the highlights of it, you've heard the dialogue. Would request a motion and a second to approve said report so it can be submitted to the commission.
Motion to approve, Erica Rist.
Motion by Erica, is there a second?
Chris McCann, I'll second that.
Thank you, Chris. Second by Chris. Those in favor, say aye.
Aye.
Any opposed? Hearing none, that is done, Valerie. When do you have to submit? When is this due to the Commission on Behavioral Health?
Unfortunately, I did have to submit it back in April. My counterpart, or I'm sorry, the very beginning of May, my counterparts and I were, due to some communication issues with some staff members at the state, we were only given about a week's notice as far as when it was due. So we had to really scramble to pull them together, and none of us were able to get them in front of our boards before that submission. So we made it very clear to the commission that these were draft reports and were likely to possibly change from that current version to whatever the final draft would be.
Okay. We can submit the final to them then with your additions. Okay, let's go into item number 5. This is to review and possible reselection of a EDR topic for the Rural Regional Behavioral Health Policy Board. Valerie, I'm going to have you lead this because you have been working on this diligently, but also remember we have an informational item or 2 coming later, so let's make good use of our time here and keep it going.
Absolutely. So thank you, sir. Again, for the record, Valerie Haskin, Rural Regional Behavioral Health Coordinator. So while I was completely elated by the topic that you guys chose, as were many people, with looking at utilizing your BDR for the implementing interstate compacts for behavioral health workforce development. Turns out everybody else would like to do this as well. And so unfortunately, this board is about third in line for the social work compact. There are some, at least one legislator who would like to bring this bill forward. And we've been asked to kindly consider, slowing down our roll on this for a little bit until they can decide whether or not they want to move it forward or if they'd like to allow us to move it forward. So that being said, regardless of who does it, somebody will be bringing the social work interstate licensure compact forward this next legislative session. I also this week had an opportunity to speak to Joelle McNutt, who is the executive director of the Marriage and Family Therapy Board. And she has not yet had a chance to formally discuss the concept of implementing an interstate compact for the counseling compact, which is just for clinical professional counselors, not marriage and family therapists with her board. She is aware that her board has some apprehensions, but they would likely be amenable to someone who wanted to bring forward that compact. But we won't know until they actually speak about it later this month. That being said, I put this agenda item here as for possible action because I would love it if the board would choose maybe a topic or 2 that I could explore and prep for a BDR, just in case we're not able to move forward with either licensure compact. So if somebody else takes the social work compact forward, if the MFT and CPC board says, hey, no, we're not comfortable with moving forward into the interstate compact, what else would you like to do? So that being said, we've gone over some very lengthy lists of opportunities in the last couple of board meetings, or at least the last one. And so I was wondering if there's anything specific that you as board members would hold near and dear to your heart that you'd like me to prep for.
Hey, this is Matt. I think Valerie, I talked to you about this before, but I still think, we got a BDR passed about information that we get from the various boards as far as who applied, how many applied, how many got approved and all that kind of stuff. And at this point, we don't really get meaningful data. So although a BDR went through, I don't think it actually does anything to, at least I think our purpose was to make sure things are moving forward and we're getting people licensed, but we're not really getting data or information to support that. So I just wonder if maybe focusing that or changing that so we actually get meaningful data. Just a thought.
Okay. Okay. All right. I'm just making some notes here. It would also really be great if we could get information from those licensing boards regarding where folks are actually practicing, instead of just where they're licensed as well. And I think that was maybe a part of the conversation. Am I on the right track there, Matt?
Yeah, I think all those things. I mean, I think if we were to look at what they gave us, like I couldn't really make heads or tails of most of the data. So I just didn't think it was all that helpful, but I get they're probably meeting the way it was written.
Gotcha. Okay. Anybody else?
Valerie, there had been some mention with regards to training for public safety answering points, i.e. dispatchers, with crisis intervention training and also the first responder community. Is there any flavor to that going forward and what we can do?
Yeah, so for context, there's been a lot of discussion recently regarding training requirements for like behavioral health and crisis training requirements for public safety professionals. And when we say public safety, that would include law enforcement, dispatch, EMS, and I believe fire. I have been working with Chief Troughton, who also sits on the post board, and he's interested in looking at and potentially revising in statute what is required in post regarding behavioral health, and having something that is more comprehensive like CIT in post, so that we know that everybody right off the bat before they venture out gets a really comprehensive behavioral health training, because whether they are officers who are pulling people over on the highways, or if they're working in the jails, regardless, they're going to be coming into contact with people who have various behavioral health challenges. Also, as of right now, it appears that law enforcement officers are the only ones who have any sort of training requirements for behavioral health. Within rollout of 988 and the state's crisis response system, we also need to maybe look at ensuring that dispatch has some training so that they are able to recognize what may be a behavioral health call versus not a behavioral health call. Then be able to transfer that person to the appropriate resources, whether it's 988 call centers or other behavioral health resources, and be able to discuss and appropriately de-escalate the situation. It seems unfair to the dispatchers that they're kind of, I mean, from my perspective anyways, kind of thrown into that without that training. And same thing with EMTs and paramedics, who are frequently coming into contact with people on some of the worst days of their lives. As of right now in statute, the only thing relating to behavioral health that's required pertaining to EMTs and paramedics is the availability of some sort of peer support service, but not necessarily any sort of training akin to CIT or other crisis response. As fire may be a little bit more tricky, simply because the nature of their response is a little bit different, but as many, fire includes a lot of EMTs and paramedics, those kind of go hand in hand. So we've got folks representing law enforcement and EMTs and EMS here. So I'd like to throw that out kind of as what are your thoughts on this?
This is Jerry Sanders. I think that moving forward to set this in place for everybody that you've mentioned is an amazing idea, because the more we get it out there, the safer our communities and the better help these people are able to get right off the bat, instead of being shoved from one place to another. And then you go from an officer to a jail or from EMS to a hospital and it's getting skipped. So I think that's an amazing idea.
Okay, thank you, Jerry.
Chris McCann here. I happen to represent us on the board, so I guess I'm probably entitled to speak, or required to speak, I guess. No, I actually really like the idea. I think it's something, as you mentioned, EMS comes in contact with these sort of patients' mental health on the regular, daily, if not more regular for our crews. And kind of like Jerry said, I think a lot of times we see them and we take them to the hospital because we don't know what else to do with them. So I think some training for the EMS folks to help understand what to look for, what kind of help that person might need, some ideas of when to identify crisis and what to do with that. Like those are the sort of things that kind of come to my mind as things that I see in EMS, and I'm sure that probably ripples across our friends in public safety from fire to law enforcement. So I think that would be an important one to look at.
Okay, awesome. Thank you. Okay, any other thoughts?
Well, I brought up the idea of the additional training. I also have to be problematic in will there be resistance to well, we have representatives here who support it. Will there be resistance within those agencies that might there's going to be a burden on them? What would be the the pressure that could be applied in statutory language to make it happen?
Yeah,
Just
I think
looking
that
for wins here, where if we go with Matt's suggestion of crafting out an actual list of what our board members and others want to see in the reports from the licensing boards that make the reports meaningful, might be an easier lift, and have that scripted in statutory language that holds them accountable for that gets to our end goal of what we were trying to do 2 sessions ago.
Yeah, I think there's definitely pluses and minuses to both sides. So on the data piece, I think the fact that the reports that we received from the various licensing boards were wildly different in their comprehensiveness really illustrates how it can be interpreted in many different ways. For example, the MFT and CPC board, as well as the Board of Psychological Examiners, sent us very comprehensive reports. And upon talking to Joelle earlier this week, she said SB 44 was very helpful in a lot of ways in helping them set up and get prepared for the potentially entering into an interstate licensure compact and making them eligible in that way. But also, I thanked her for the report, and she said that's just what she submits to her board. So I believe that it appears that different boards have different processes and requirements, and the language as it stands, like I said, can be interpreted in different ways as far as what's required for reporting. With the training for public safety professionals, I think that there would be definitely a lot of positive momentum from like the legislative side. However, when it comes to funding, and something that I didn't even consider, is that public safety agencies, generally speaking, their budgets are rooted in county budgets. And not all counties have a whole lot of money. And so even speaking to people outside of the region, kind of testing the waters to see what the issue might be. One person who has stated that he wanted to remain nameless mentioned, as from a county perspective, it would be probably something that they'd have to be against simply because it might negatively impact their budget and they don't have any money. So there's pluses and minuses to both. The training piece would have a big impact statewide. However, it would be a much bigger lift and a little bit more complicated. The data bill would be a much lighter lift, but it may not necessarily have the same impact statewide. So Jerry, I see your hands up.
So in looking at both aspects on the data and the CIT, if we were to be able to combine those two in the way we word it and the way we go forward, we could basically take out two birds with one stone. And is that a possibility? To speak on Fergus's question about pushback with CIT, I've been in law enforcement for a very long time. Any change whatsoever, it doesn't matter what it is, we're going to scream about it. That's just what we do. We don't like changes, but that comes from being an A-type personality. That's just the way it goes. But if we can get CIT into the academy and into post and move it that way, we have less pushback from the budgetary position because it's going through post. Also, it's already in the NRSs now that we need to start ensuring that all law enforcement is up to date with CIT, at least 8 hours of training, I think it is. So it's already in there. If we could just take and put that push a little bit forward and encompass the two with the wording, is that a possibility?
So hitting both the licensure data piece and CIT?
Yes, ma'am.
I don't know, simply because they're affecting different kind of categories of professionals. I think we could probably do the licensing data and the interstate compacts alongside each other a little bit better because they're affecting the same agencies. Does that make sense? I don't know, Fergus, what's your take on it?
Yeah, Valerie, that would be my take on that. Is they're at different points in the spectrum of the licensing boards and those in their interstate compact with that licensure piece and their reporting thereof, and then what might become a standard for police. My gut feeling is, yes, it's good. CIT, being CIT trained myself, I get it, I understand it. But I would say that it would be something that would be better if it came from the Sheriffs and Police Association or some arm or group like that in the state to create those standards for the academy. For us to get into that, I can see it be wrought with resistance.
Yeah. So, well, okay. So that being said, what I can do is I can play around with these two concepts and really focus on them for the next couple months. And then come the August meeting, when we need to have hopefully the BDR language and concept really finalized for submission by September 1st, we can look and see what that looks like, because that's really the intention here, is to have a backup or two in case we can't move forward with the interstate licensure compacts. And it's likely that if we open up the different chapters for the interstate licensure compacts, that we can go ahead and add in the data piece too at the same time. And I feel like that would be a good, probably a concession that we could speak to the licensing boards about making, since we're doing this for them, and getting this taken care of. And then if if we are able to move forward with licensure compacts, then we have another potential bill draft request that somebody else could pick up if they'd like, regarding the training piece. The CIT International does have a standardized training for dispatchers. It's fully online and it's only 8 hours. So when we're looking at training for some of these different agencies that isn't necessarily for law enforcement officers themselves, we can also be a little bit more flexible when we look at what maybe that format looks like too, because we don't, from what I'm aware, we don't necessarily have a standardized best practice. Now, you and Chris may have, being EMS current and past yourselves, may have different experiences with that. So, but I just wanted to kind of throw that out there. And I think Jerry had some really excellent points on, you know, bringing it into like early training pieces as well.
What I'm hearing from that, Valerie, is not necessarily a concrete action item or action taken to any specific bill draft request topic, but for you to maybe flush out some information to have ready for us for our August board meeting.
I believe that is accurate.
And Matt, if we could possibly contact you again, and you and Valerie work out some maybe a structured format of what that report might look like, we might be able to get more meaningful data from the licensing boards and hold them accountable.
Great.
Okay, and then also with the training piece, when we look at law enforcement, it's natural to lean towards the dispatching side of it also. Most of our public safety answering points are law enforcement centric, and then they might also answer calls for or be the answering point for EMS and fire. So I think it's important that we keep the dispatch and law enforcement in the same breath. And then Valerie, with your work with CIT and Chief Trotton out in Elko, work out a way to flush that out so that it's acceptable by the police and sheriffs of the state across the board. So we don't have anything coming back to haunt us.
Will do.
And even if they want to submit that one be great. Take that off the plate. Okay.
Perfect.
So
Thank
you got
you.
a plan of action there?
I do.
Okay. Any other dialogue on action or on item number 5? Okay. Okay. Let's go on to number 6, which is an informational outcomes of Assembly Bill 37 and the development of Be Here, Nevada. Dr. Sarah Hunt is with us. I wanted to have this brought in because this was your bill last session, board, and just so you can see the tremendous, you know, I'm lucky that I get to see these progresses that Sarah's making with her team down there and the advances that are forthcoming. But I wanted our board to be well aware that you did the work. Now let's see what the harvesting looks like. So Sarah, I'll turn it over to you.
Thank you very much. Sarah Hunt, for the record, Executive Director for Be Here, Nevada. And I will just spend a couple minutes with you because I've got to hop off for another meeting. But Valerie, I sent you a photo. I don't know if you could see it and could share it on your screen, but a really quick update. Because we will be sending you a copy of our legislative report for this year in a couple weeks. So we have got to do that by the end of this month and get that out, not only to the Legislative Council Bureau, but it goes to each of the 5 policy boards and goes to the Board of Regents and the Nevada System of Higher Education. Oh, that picture? Oh, wait. Did I send you that picture? So one thing
We're definitely in
that,
Nebraska.
yes, so a really quick update from just this week, breaking news. Myself and my team, we have a total of 5 of us now that are full-time staff for Be Here Nevada. We got to do a great trip out to Omaha this week and spent 2 days with counterparts from the Behavioral Health Education Center of Nebraska, the model that we are built on and built after. And so we spent 2 days with them, meeting with counterparts, hearing a lot of lessons learned from them over the past 10 years. They also took away some areas of interest that we shared that we're going to be focusing on. And so it was a great opportunity to bring the 2 centers together. And that was part of what we wrote into our budget, was to have a kind of a 1 year of technical assistance and consultation with the Beacon folks. So we started that journey this week, and it was very helpful. In our legislative report that you'll see, aside from spending a lot of time hiring folks, we were able in the past 3 months to get out and start doing some of the K through 12 outreach. So there will be a section in there about the 4 or 5 different high school career fairs that we attended and some lessons learned from that. May 1st, I was able to bring on Roberta Miranda Alfonso, who is going to head up our retention efforts and that outreach to adult learners. So she is onboarded with us now. And Roberta and I have been doing a listening tour with the licensing boards. So to hear a little bit from their perspective, what it's like, kind of welcoming in the graduates from our programs, maybe what would be helpful from when the students leave the academic side and prepare for licensure, what would be helpful to kind of best support them. And then we're having the conversation on the other side with the academic programs, what are you doing to prepare your students as they're leaving academics and preparing for licensure. So we're kind of wrapping up our listening tour with that, but we have learned a lot along the way in just these past 3 or 4 months as we, kind of lay our foundation and get started. So more to come in the report, but any questions, anything that I can answer?
Anything from the board, or just be aware that Sarah and her team have been going out to some of the school job fairs and things like that, so that you may see them out and about, whether it's this year or in the future. But they are not only just centered in doing work in Las Vegas, they're coming out to our rural communities also. So great resource there with Sarah and her team as they develop this ongoing structure. Any questions from the board? Valerie has her hand up.
Hey, Sarah. So a part of the bill was for the center to have an advisory board. So that being said, I'm wondering if that has gotten rolling yet, or what the plans are for that.
Yes, very good question. So that will be covered in our what's coming next section. Yes, yep. So as we head into year 2, with the new fiscal year starting July 1st, that will be one of our top initiatives, is to get our advisory consortium up and going. So more to come on that.
Excellent. Thank you.
Any other questions? Thank you, Sarah.
Thank you again, and we hope to share more updates with you. And again, thank you all for choosing this bill last session.
This was a good one. Exciting to see this grow. We'll go on to Valerie, the updates regarding item 7, excuse me for those following along, regarding the activities, resources, challenges, and other work of the Rural Regional Behavioral Health Coordinator. Valerie, it's 2 p.m.
And for the sake of brevity, I'm not even I didn't even put together a formal paper report. So I've been pretty busy with different presentations this last month. I was able to present to the interim HHS down in Vegas on May 13th. And got to field some interesting questions. I would anticipate some interesting legislation coming through regarding behavioral health infrastructure based on the questions and concerns of members of interim HHS. Senator Doñate, who is the chair, mentioned specifically, how do we keep organizations from passing the buck, which I think all of us have kind of seen happen in different perspectives. I know Jerry's seen that happen very, very recently, and for HIPAA reasons, I'm not going to get into that, but it is a major issue when it comes to patient safety and quality of care. That being said, preparing for my first assist training with Pershing General Hospital and some other trainings coming up here in June. I've also been working on things related to your BDR and trying to identify the best ways to kind of go about navigating some of these waters with different legislators and things related to the BDR itself. So if you have any questions, please let me know. And I'm going to go ahead and yield because it's 2:02 and I know you probably have other things you'd like to do.
Any questions from the board? Valerie, you'll just continue sending out the emails periodically to our board members so they know between now and August of some of the activities that you're participating in, so they can also help engage their stakeholders in their various communities or areas of expertise.
Yeah. Oh, and Fergus, just really quick, there's one last thing I would like to mention. A lot of my time this last month has been taken up preparing for the COSUP, which is Comprehensive Opioid Stimulant and Substance Use Program grant opportunity. The Nevada Attorney General's Office will be applying for this opportunity from BJA yet again for it's a 3-year grant cycle. And I've been working with Dr. Terry Kearns, who I believe was on the line earlier, to ensure that we have the opportunity for the criminal justice and law enforcement agencies in our region to apply for those funds. So it looks like we're going to have good participation, focusing on some fast programs, and a lot of funding and programming to build out more robust and comprehensive CIT across the region. So that's that piece.
Excellent. Okay. Item 8 is our next to the last public comment. Seeing anything pop up. We're getting close to the adjournment. So Valerie, just a reminder, our next meeting will be when?
I'm sorry, I
August
need to
2nd.
Yes, August 2nd.
August 2nd at 1 o'clock. So if you don't have it on your calendars, please mark your calendars respectively, and we'll communicate in between times, I'm sure.
And board members, if you are able to make that meeting, please do. That will be where we will be finalizing the BDR concept and language that we will be submitting that following September 1st or before then. So it's a very important meeting. We don't want to have to miss it.
Okay. Board members, anybody have anything for the good of the order? Okay. All right. And with that, call for an adjournment at 2:05. Thank you everyone for attending and the dialogue shared today.
Bye.
See you guys.
Thanks. Bye-bye.
Thank you.